Okay, welcome to tonight's NIU STEMCafe. Our topic this evening is DeKalb County Health Department in the trenches of the COVID-19 response. Our STEMCafe this evening is brought to you by NIU STEAM and the Center for P20 Engagement. I am Judy Dymond, organizer of the STEMCafes for the past 8 years and host for this evening. STEMCafes are designed to connect the greater community to the latest research and hot topics in a casual environment where adults eat, drink, and chat. Tonight, we will need you to provide your own favorite snacks and drinks. But our heart goes out to our restaurant partners. We wish them the very best during these times, and we look forward to getting back to the restaurants. Tonight, NIU STEAM is partnering with DeKalb County Health Department to bring you the STEMCafe. Tonight, you will learn what is going on behind the scenes and see your health professionals in action against the COVID-19. Our speakers tonight are Lisa Gonzalez, Public Health Administrator at DeKalb County Health Department, Cindy Graves, Director of Community Health and Prevention, Health Promotion and Emergency Preparedness, Rick Amato, State's Attorney, DeKalb County State's Attorney's Office, Melissa Edwards, Emergency Preparedness Coordinator. We are proud to say that the 4 of our speakers this evening have all been NIU grads, so we have 4 alumni with us this evening. Tonight's format will be similar to our live STEMCafes in the restaurants. We're going to have a presentation for approximately 1 hour. We're going to follow that with Q&A and discussion, and the STEMCafe will end when we have no more questions or 8:30 p.m. With that, we are going to begin. Thank you for attending.
Good evening, and thank you all for getting online tonight to participate in the STEMCafe. We also wanted to thank NIU STEMCafe for inviting us to present and for setting up the virtual platform to make it happen. So you're joining us tonight to hear more about what happens behind the scenes as it relates to our COVID-19 response. We have put together a presentation for you that we hope will give you a lot of information that you may not know, because a lot of it happens behind the scenes, but we're hoping that you'll learn something new, and hopefully you'll be able to share some of the information you learned tonight with those around you. So where it all begins, notification of potential cases. You can see by this graphic here that COVID activity is widespread at this point. Every state in our country is experiencing COVID activity at different levels. This information is it's changing every single day, and the situation is evolving every single day as well. As of today, IDPH has reported COVID-19 cases in 56 counties in Illinois. So you can see by this graphic here where it's shaded in blue, it shows you where that activity is occurring. To date, IDPH reports 6,980 positive cases, including 141 deaths in Illinois. As of today at noon, this graphic represents the local activity of COVID-19. We have 16 lab-confirmed positive cases of COVID-19. We started to see activity in the middle of March, and through the end of March, we continue to see activity pop up. We'd like to show a short video. This video was actually released several weeks ago, but we believe that the overall messages are still very much relevant. You'll hear the video mention travel-related illness. That was the issue at the very beginning of the outbreak, but we are now seeing a lot more community-acquired activity happen.
So we need to get the facts straight. How does this virus work? How does it transmit? Where does it want to go? And let's protect ourselves. I'm Dr. Peter Lynn. I'm a family physician in Toronto, Canada.
Can you close that nipple?
The corona.
Give a play out in the corner.
Where?
Like over here. You got that little play? Yeah. No.
So we need to get the facts straight. How does this virus work? How does it transmit? Where does it want to go? And let's protect ourselves. I'm Dr. Peter Lynn. I'm a family physician in Toronto, Canada.
Is that showing down here?
No. It's not. Just go to the next slide. Or tell them what it says.
Okay. It looks like we're having some technical difficulties with the video, so we will go ahead and proceed forward in the presentation. Yeah, we can send the link out electronically.
Okay, prevention measures. Go ahead and click. Thank you. So it's always important to remind that all of the best of, no, back please. Thank you. That all of the best defense mechanisms are really the very simple ones. I know you've heard this over and over again, but we also hear it. You've heard it also every time that the governor is speaking. It's just always a good reminder to, again, the best defense mechanisms are the simple ones. So cleaning your hands frequently, getting those high touch points after you touch something, make sure that it is cleaned off so that the next time someone touches it, it is clean. Cover your cough or your sneeze. COVID is spread through large particles in a cough or a sneeze. So it's especially important to cover with a tissue or do the sneeze into the crook of your elbow or something like that, so that you're containing that or you're covering that. And then containment, that is by staying at home, especially if you are ill. Social distancing, we've sure heard a lot about that lately. And it is a really important piece of the containment. As you know, the stay-at-home proclamation was just announced through the end of April. Yesterday, the governor made that announcement. And it is also important to remember that we are all at risk, so staying home as much as possible is really important. And when you're out, be conscious of staying 6 feet apart. Next, please. So to reinforce the 6-foot rule, we are seeing a lot of helpful signage in stores. Even locally here, we're seeing this where they're marking where 6 feet is. So helping the public to actually visualize that is an important measure. So let's talk about store exposures, because there's an important distinction that can be made by illustrating what is happening in stores. So the significant exposure with COVID is defined as less than 6 feet for greater than 10 minutes. So if you are less than 6 feet from someone for greater than 10 minutes, they're saying that your chances of exposure are greater. So contrast that to the measles, because with measles exposures, all you have to do is just walk by someone and you are potentially exposed. There is no time limit, and again, it's immediate as far as the possibility of being exposed. So this is also important because when we are doing investigations or any of our follow-up with things, if we have a measles case, we are out at stores and we are posting, notices to the public saying if you were in this establishment on this day between these hours, you need to watch for symptoms because you could have been exposed to the measles. So with COVID, however, we don't even have, when we're talking to people about their potential contacts, we do not have to even go into if they were at a grocery store. We don't have to worry about that because the chance of somebody being less than 6 feet for more than 10 minutes in a grocery store are very slim. So that gives you a little bit of an understanding of the difference in the ability to transmit in between those two at least. So the lab testing and the lab processing. We use, I have a picture there of the nasopharyngeal, where the swab is going. So it's not just the nasal cavity, but it goes back further into the pharyngeal area. This is not a new testing procedure. I've been a nurse for 35 years, and I've done them for 35 years. So this is not a new testing procedure, but it is the type of sample that we need to be able to test for COVID. So there are two routes to being able to be tested. One is through IDPH, and we, as a local health department, are the ones who have to approve that ability to send that to IDPH. The provider will call the health department for permission to send to IDPH, and we do some further screening as part of our role to make sure that it's an appropriate submission of the test. And then we provide an authorization number so that they can send the test, and then IDPH will test that. The second route now is the private lab testing. 2 weeks ago, yesterday I believe, we started seeing where a lot of the private labs were able to open up. They had been approved to be able to do the testing, and they started doing a lot of testing. So the provider can send the sample actually directly to the private lab for testing, so no state permission is needed for that route. Okay. So testing parameters. I know you also have seen that the parameters for testing have changed just in this last month. They've been greatly tightened, largely due to resources, because as we have heard, the ability for the resources to be able to do the testing are limited. And the other thing is that we need to remember that testing does not change the treatment. It's more of treating symptoms than it is treating the result of the test. It was important to do that testing, especially at first, but as we are now seeing the transmission become much more community acquired, that testing piece is starting to fall off as being the guideline. So again, testing does not change the treatment, and it is reserved for those who are hospitalized, for healthcare workers, and for the first responders, EMS and police, and any of those first responders. Also, it is provided for people with symptoms who have a high risk of complications. So that is another way. And then the third thing that is very much on the radar and is abided by is that those with chronic health conditions and those in congregate settings. Now, the congregate setting piece is very important. So we're talking the long-term care facilities, meaning like your nursing homes and rehabilitation centers, homeless shelters, group homes, those who are incarcerated. So that is really important to make sure that you stay ahead of the curve on any of those facilities, because as you can imagine, one case there and it could potentially spread like wildfire. So we definitely want to know as soon as possible. So anyone who comes from any of those areas, those congregate setting areas, are pretty much right away it's approved, because that's so important to stay ahead of that. Okay, so 5 points about COVID-19 testing. So again, this has evolved. Our guidance changes frequently, as you know. So the first one is, if there's no symptoms, then no testing is needed. So this would come into play if someone was worried that they were exposed, but if they're not displaying any symptoms, then they would not be in line to be tested. However, if there is a thought that they were exposed, then that's where the self-quarantining, and again, there's various levels of the quarantine situation, and we will talk about that a little bit later here. The other thing is to make sure you call before you go to your healthcare provider. Healthcare providers are having to switch up how they are providing their care, and part of that is that, again, that social distancing. The last thing that they want is someone who is experiencing symptoms to come into their office and expose other people. So some of them, a lot of them are doing the telemedicine. I know they're doing a lot of phone calls. They're extending prescriptions that they maybe normally wouldn't, that would normally need a visit to extend that. All of those kind of things just to kind of get us through until the curve does flatten. If you have mild symptoms, you can contact your healthcare provider, but most likely, again, you won't be tested to reduce the exposure to others and the prioritizing the testing, as we talked about earlier. Going to the emergency department. Only go to the emergency department if your symptoms are severe. Again, social distancing and minimizing the exposure to others. Testing does require clinician's order. So I know there are some circumstances, like going to Chicago right now, where there's drive-through testing for healthcare providers and those kind of things. But as for the general public and most healthcare workers outside of those situations in Chicago, those drive-through situations, it does require a clinician's order. So you need a physician's order to be tested. So once public health gets a lead on a possible case, what are the next steps? Well, case investigation is something that the communicable disease programs have done for years. As you can imagine, there's all sorts of other communicable diseases out there, and we do have to do case investigation that basically puts the pieces of the puzzle together so that we have a better understanding of what the chances are of the spread of that disease, epidemiological links to that, all of those kind of things. We kind of laugh and call it that we're kind of the Nancy Drews in putting this all together. One of the things that we have available to us and that we use very frequently, daily as a matter of fact, is a reporting system through it's called the Illinois National Electronic Disease Surveillance System, which is much easier said as INED. That's how we refer to it. And it is available to monitor the suspect and the confirmed cases. So that's a screenshot of our, what we call the dashboard there. And that is something that we check, again, it's our first go-to in the morning, where we go into INEDs and we look to find out what kind of cases are there. Labs, the way that those populated is primarily through labs. When a lab gets a positive test on any of the long list of reportable diseases, they dump this into INEDs, and then it's sorted by county, and then we are able to take a look at what those cases are, decide the level of investigation that needs to happen, and then begin that case investigation. So that's kind of our go-to first thing in the morning of what's kind of on our agenda for the day. So COVID investigations are classified in basically 3 different ways. We have the first level basically would be something called persons under investigation, or PUI. You may have heard that term. Most cases are, these are most of the cases that we receive that are the PUIs, and they're people who are either being quarantined with no testing because of just exposures, or it could be someone who is awaiting testing, so that you make sure that they do not have any additional contacts until you know for sure what's really going on. Once we would get a negative test result on them, then they are most likely released from the quarantine. But again, it depends on other kind of factors, and we are on the phone talking about that. And on the right there, that is an example of one of the forms that we use as a template to talk to them about all of their symptoms, when their symptoms began, and what their contacts are, and we just kind of try to retrace steps. If they have had any travel, we get the information on their travel itinerary so that we have that just in case there's additional information that needs to be retrieved from their travel history. So then the next would be confirmed positive, kind of self-explanatory. So someone who's been diagnosed with, and we underline, a lab-confirmed COVID-19 test. Now, a lot of places, as this evolves, a lot of places, emergency rooms, doctors' offices, are seeing someone and they may be exhibiting some signs, but because of the testing situation, and rightly so, they might send them home and say, you know, you might have it, so they might send them home and say, go ahead and self-quarantine and kind of watch for any symptoms for the next 14 days. Kind of gets confusing for people because they okay, am I diagnosed with it or am I not? And the answer is maybe. But at the same time, as I said, because we're not necessarily testing everyone at this point, it is just a safety mechanism to make sure the contacts stay at a minimum. Then we have what we call presumed positive. So this is someone who has had intimate contact. So, for example, living partners or their children, elderly parents, whatever, where they live in the same household. And one of the people in the house has a lab-confirmed positive. So we know that the lab-confirmed person is in the house. If and as other people in the house start developing symptoms, then they are not tested for some of the reasons that I already talked about. They are not tested, and so, but they are considered what we call a presumed positive. So they're around someone, the likelihood of them becoming positive also, and then they just start developing symptoms, they're presumed positive. And again, testing is not performed, they are just presumed. So I mentioned earlier that we make contact with the patient and we do the activation of the case investigation. And we confirm, again, the onset of the symptoms, the date of the onset. We determine all potential exposures, identify people who would be considered close contacts. And as I mentioned earlier, one of our framing questions that we use when we're talking to someone about the investigation is keep in mind the rule at least less than 6 feet apart for more than 10 minutes. And then that kind of helps them to think, okay, they don't have to talk about the grocery store visit that they made, you know, or some of those more fleeting kind of contacts. So that helps them to kind of frame what they need to be telling us. Confirm that the person is being properly isolated at home. The guidelines are different based on different situations. It's kind of hard sometimes to keep up with it, but that's what we're here to do, is to help them decide based on their situation what they need to do to both protect themselves and their family members and the community at large. We also work very closely with hospital infection control practitioner if the case is hospitalized, and they oversee while they're in the hospital, but we oversee the relief to make sure that quarantining, isolation is being done once they're home. We also then, as public health, we talk to them about any other needs that they might have. Do they need meals brought in while they're at home now being self-quarantined? Do they, other kinds of things, maybe medications, something like that they need. So that's our role also, is to make sure that if they don't have other means, family members or whatever, to help them with that we provide that during a disaster situation. Okay, so you hear a lot about isolation and quarantine. So there is a difference. So we'll talk about that a little bit. So isolation is when someone does have symptoms of the contagious disease, and they are protecting themselves, or they are protecting other people. So they already have the symptoms. We know that they have the virus, and so they are isolating so that they are not infecting other people. That can be done within a house, It could be done, doesn't mean that everybody has to leave the house for isolation. It can be done depending on the situation at home. Can be where they isolate in their own bedroom. We like to see that there's a separate bathroom that they can use, and they can just keep themselves confined in that way. So it doesn't necessarily mean everybody has to move out of the house. Then the other thing with quarantining is where you are separating people while you are watching them to see if they're going to develop symptoms. So I found this great picture here of astronauts that when they come back, we all have heard that they quarantine for a while to make sure that no one develops any symptoms before they are finally released, even to their families and the community at large. So that is the difference between isolation and quarantine. I'll let Rick talk a little bit about isolation and quarantine and how that works.
Thank you, Cindy. So the isolation and quarantine does have an aspect where there is constraints on somebody's movement. And the health department, as we can see, has been dealing with infectious diseases for a long time. The public dealing with infectious diseases is something that's very new to many people, and the concepts that the health department has certain orders and certain powers that they could do is unique, and most people don't understand or realize what can be done. So if a quarantine order is in place, the first line of it comes from the health department. The Illinois Department of Public Health and our county health department are at the center of the public health and the center of maintaining the safety of our public is with the public health during this type of pandemic that we're having. So if somebody's going to be quarantined, that first comes from the health department. They will be presented options, and most people would ordinarily be agreeing to the quarantine and the orders entered in place. There is a due process part of this because it is a scary function when somebody's not well, their family members are at risk, and then they're being ordered into quarantine, where our office, State Stream's office, could intervene. So we've been working alongside our county health department partners and putting together a process that ensures that the law is followed while we're doing these quarantining processes. So we've developed templates to make it as user and easy for people that need to come into court. So if somebody is objecting to a quarantine order, they would petition, or our office would petition the court, and we would appear in court in front of a judge. We've trained out our office, myself, as well as our chief of civil, his name is David Burrow, to do these petitions, as well as work with our court personnel in case this would become necessary. So there's many types of orders. Because you get an order from the health department, that needs to be followed. If that is not being followed, the health department could mandate up to 48 hours where you must be quarantined, even if you're not agreeing to it. Goes past that, then it comes to the court system, and the powers of checks and balances of our system gets put into place. We at the courthouse have been working alongside all of our county officials as well as the health department, and we too have a shutdown in our offices in our courthouse where we have limited functions, very limited proceedings are going on. This would be a proceeding that would be expedited and go in front of a judge right away if we were brought into a situation where we needed to contest a quarantine because it was in the public's best interest that the person that is suspected or has COVID would need to be quarantined.
Thank you, Rick. As Rick mentioned, this is not a new process for us. It is part of communicable disease. We frequently have to isolate or quarantine someone who we're watching for measles. We're watching for symptoms of measles in a quarantine state, and then if they do develop the measles, then it would switch to an isolation. We have never, this is not something that is done lightly by any means. We never want to restrict anyone, but if it's for, our role is protect the larger public, and so if we had to, we would. But like I said, we try to work with the person. What can we do to make this more palatable to you? All of those kind of things. So we have never had to go to a court-ordered isolation and quarantine that I'm aware of, anyway. So again, not something that's done lightly, and we do have the administrative code there at the bottom that gives the power for this.
And if I may to lead, and I touched on it briefly, the health department has that power to make this order. Some people don't realize that we've come in contact with the health department's empowered in a role where they could order somebody to stay in their home. It's not coming from law enforcement. Law enforcement can get involved with the enforcement and make sure the order's carried out, but we do not need to be in the court system for the Department of Public Health to be ordered to have the power that they have, which again is protecting our public from further outbreak of this disease, infection.
Okay. Thank you. So protecting each other, we are really all here to watch out for each other, and we certainly do not want to forget about our first responders because we know that they are frontline. When I worked the ER, we always used to say they are eyes and ears and such an important piece of this. So we want to do everything that we can for those that are initially responding to protect them. So the process that we are using to alert them and to keep them safe is something called a premise alert. So upon identification of a person that's awaiting results, the PUI, or if we do have someone who is tested positive, a premise alert is entered into the 911 dispatch system. So they are used for several situations. Again, this is not a new thing for this situation. This has been in place for a very long time as a means to communicate special circumstances to the responding personnel. So, for example, if someone's called, the first responder called to the address, and it would come up in the 911 dispatch showing things like the person has certain disability needs or certain medical situations that they need to be aware of before they get to the house. It is used on a need-to-know basis mechanism only. So it protects the providers while it protects the privacy of the people who are affected. So if 911 is called, as I said, then the alert pops up on the screen. They let them know, and for the responding EMS or police, and to make sure that they're wearing extra, or that they are using extra protective precautions. Now, we know that everyone should be on alert all the time, especially during a time like this, because you never know when you're going to be coming into contact with someone with this particular virus or any other virus or condition that's out there. But we do feel that we owe it to them to give them a little bit of a heads up, because human nature is just that you will be, if you know that there's something going on there, then you will be more cautious in it. So it is tagged by the address only. There is not a name. And once the quarantine or the isolation time has passed, then cancellation is sent and they take it out of the system. So again, it's a way to protect them while maintaining privacy of the person. And it's a general alert, so it is not. We do not distinguish between someone who is just waiting for results or someone who is positive. So again, we try to take every measure to make that balance to be able to protect the first responders and protect the privacy of the individuals.
This is a piece that we're working very closely with law enforcement on, in fact, on a daily basis of making sure our fire and our police are protected and have as much knowledge as they can. As Cindy said, it's a balancing process. The privacy rights of those that do have the infection are very important, and it's taken very seriously by the Department of Public Health, and they're the ones that control the information flow and have the power to disseminate the information. And HIPAA is something we'll be talking about momentarily in the presentation, but this is where it comes into play of how this information is getting out and what's being put out about them. And it's something that our law enforcement and fire protection folks are very in tune and paying attention to daily.
And one last thing on this, so as part of our case investigation, if it is someone that will be entering into either isolation or quarantine, We try to make every effort to just notify them while we are doing the case investigation that this is the process, tell them what information we are sharing, and so they're aware. So it's not something that's covert, and we make sure that we let people know that this is the process, and everyone has been fine. I think they understand that we're just trying to protect everyone. So. Okay, alternative housing. So we have been working very hard to develop a plan that secures alternative housing for individuals who are not able to isolate or quarantine in their own home. Of particular concern are the group homes, where the group homes or our Safe Passage or Hope Haven or homeless shelter, where just by definition of why they're there, they don't have a lot of other options in terms of alternative housing. Most private citizens that are in their own homes have been able to work it out, where maybe the wife and children go stay at the in-laws or something like that, so that they can maintain that separation. Again, this is it's a mechanism of providing for housing on those that do not have other options. So with on the right-hand side there is just a template of part of the plan, the kinds of things that you need to address for that. But it's things like, of course, we're determining where the physical location is going to be for that. The provision of medications, monitoring for symptoms. We would call them. They would be given a thermometer and a symptom log to be able to log their symptoms and temperatures twice a day. We would check in with them twice a day, public health would, to make sure that things were going all right and to see if they have any other needs. Medication needs, we want to make sure that those are met. Communication, how are we going to communicate? Do they have a cell phone? Are we using landline? All of that. And then another piece that I think is very important that we have written into the plan is that of the mental health needs. So also part of our plan is that arrangements are made through the DeKalb County Community Mental Health Board. Arrangements are made through them to a provider to assign someone who would be the check-in person from a mental health standpoint. Not even if it's someone who has other mental health needs, but for even someone who is just, they're going to probably want to talk to somebody. Isolation would not be easy. And so we wanted to write that provision in so that they had someone that they could talk to and kind of work through that situation with them.
So messaging is something that's frequently changing, and so this is a great opportunity for us to share as the health department how we're relaying that information to the public, and also some gaps we've already addressed and identified, and in ways we're trying to spread information out to the public and also community partners. So with notifications of positive cases to the public, IDPH updates the case count at noon each day. And so this case count is included in the daily count for the briefing that the governor does at 2:30. And so initially, cases in our county that were announced, we used news outlets. So through the DeKalb County media outlets that we have, we posted on social media, updates on the website, and then also information sharing through our community partner listservs. As we anticipated with the increase in cases, we've moved to reporting cases on our website, and then also the community COVID-19 newsletter, which we'll talk about on the next slide. So with the COVID weekly newsletter, this is something we had to adapt quickly to make sure we get information out to the public. For those who don't have social media, for those who may not read the paper, may not have access to the online paper, and just trying to think of different creative ways to reach the public. And so we quickly adapted, as I said, to create this new newsletter. We've already sent out 6 newsletters. Typically, you can see on the right some of the screenshots from the newsletter that we sent out. Typically, it is our case counts, any new cases that we may receive. In the very beginning, we were sending out press releases through this newsletter as well. And we also share a lot of reliable and credible resources, which I know is very hard to sometimes filter through, and we'll talk about that on the social media page. But we share those reliable and credible resources with this newsletter in hopes that the public, all of you who are on this conference or this event tonight, can share that credible and reliable information. So moving on to the social media piece of it, this is another opportunity where we share a lot of information. The social media, we have Facebook, Twitter, and Instagram. Those are our three main components that we use at the health department. And really, social media is our way to share the prevention efforts and what's going on from a regional level, statewide, national, and locally if there's some things going on. Social media, as you know, it's more of a adding a little local taste to what's going on too, and what we're doing in our community and what others are doing for public health in the community. And then also we have our DeKalb County Health Department website specific to COVID-19. And really on our website, it's an opportunity to show the cases. The cases are all updated on our website, and our newsletter is there so you can go and sign up for updates. And then also the links to credible and reliable resources. So CDC, FEMA, World Health Organization, IDPH, a lot of the resources that we also refer to for guidance.
So as it relates to the data that we share related to COVID-19, we have had a lot of questions come to us related to the numbers of individuals tested for COVID-19. The health department has not done testing for COVID-19, and at this time we don't have a total number of COVID-19 tests available to us. As Cindy mentioned earlier, labs are required to be reported through our electronic system. Those positive lab results are required to be reported. That's how we're able to report out positive cases to the county. But the negative results of COVID-19 are not necessarily required to be reported. Many labs are reporting those numbers to us as well, but we don't consider that number as reliable for the reason of it not being required. So really, as it relates to testing goes, all we have is the positive lab results, which are reliable. And so sharing the total number of tests wouldn't really be our information to share, as we're not currently doing testing. Another question that we often get is about the information that we release on lab-confirmed positive cases of COVID-19. So as you're probably aware at this time, we're only releasing decade of age for our positive cases in the county. And we really are following, just like we do for other communicable diseases, the IDPH Communicable Disease Code. And what that code says in short is that in order to protect patient privacy, we should only release what is relevant to the disease control and prevention efforts. Because we believe and we know that COVID is much more widespread than the positive cases reported, we do not believe that by releasing additional information at this time that it would be in response to the actual outbreak itself, or be preventing or protecting the public any more than that. We really want to just reinforce the importance of social distancing, the importance of those prevention messages that were mentioned earlier. You may see counties to the east of us beginning to report positive cases by municipality, but if you look at their numbers, the counties that are doing that, they're much larger. So there are 100+ cases in those counties, and therefore the individual cases are not as identifiable. The health department does fall under HIPAA, and so we do make patient privacy a priority, and we believe that we should release the minimum amount of information on the individual patients in order to protect that privacy. Anything more on that, Rick?
A lot of questions do come out on balancing privacy versus public informing. And the public is concerned when you have a pandemic of what's happening, where is this spreading? And the Department of Public Health, through the IDPH, as well as the county health department, they have the power as well as the discretion on how to monitor the information to get out. They were analyzing, is this going to help prevent the spread? Is there some type of public need in getting that information out? And if they feel that it's not productive in getting the word out or preventing or keeping somebody from else from getting the disease, getting the illness, there it's within their discretion to make those decisions.
So the efforts that we've been involved in are not in a silo by any means. We have been working very closely with a lot of our community partners. Melissa mentioned a lot of the information that we were pushing out, but there's also a lot of dialogue happening, a lot of meetings occurring. Early on in our response, we did have several face-to-face meetings before the social distancing was put into place and before the schools had closed. We had several meetings with partners just to sort of talk to them, update them on our response, but also talk to them about very specific response-related issues that would affect them. So we met with the DeKalb County department heads in order to update them, but also to talk about continuity of operations planning. You may be aware that within DeKalb County government, there's been a lot of changes that have happened. A lot of our county buildings are not really allowing visitors at this time. More people are working from home based on recommendations that are out there. So really starting that dialogue around what are essential services for the county and how will those change moving forward. We also met before the schools were closed at the governor's orders. We did meet with DeKalb County superintendents to begin that discussion about what would be that threshold for school closure. It just so happens that that same afternoon the governor announced that they would be closing. And so we are in regular communication though with the superintendents on several different issues, making sure that we're staying informed from them and also sharing information out as well. And then meeting with the DeKalb County Police, Fire, and EMS partners, we wanted to make sure they were up to date with our response efforts and also discuss what their PPE needs or their personal protective equipment needs were. We were able to distribute some of that personal protective equipment out to them early on in our response, and we continue to work with them to determine what those needs are. So now that we've moved to more virtual meetings, in fact, exclusively virtual meetings, we have been having weekly calls with our local social service providers. The purpose of those calls are really to identify needs within the community, to try to figure out how we can collectively address the needs. This issue of COVID-19 has really wreaked havoc on a lot of different businesses. It's wreaked havoc on individuals and families trying to figure out things that they really hadn't thought of before. And so we were able to have some meaningful dialogue with our social service providers about the clients that they serve and how we can mutually work together to meet their needs. So far, we've discussed issues around food and nutrition and behavioral health services, and so making sure that the community has the food that they need. We have a lot of great partners, a lot of great people working in the community to make sure that that's happening, the school district, the Barb Food Mart, so on and so forth.
So the state has many platforms, as I kind of shared with information sharing, but the biggest platform that we use for guidance from the state is what's called Siren. So that's the State of Illinois Rapid Electronic Notification System. We receive Siren messages multiple times a day. There's not even a way to really count how many Siren messages that we receive. And so through those Siren messages, there is a lot of guidance. And part of what we have to do in public health is make sure that we're sharing that guidance with our community partners and those in our community. And so on the slide here, you'll see just some of the agencies and the businesses that we've shared guidance with through the Siren system, but also using a platform that we use for sending out information that's proven to be really helpful in collecting emails and information on businesses that we can quickly and efficiently send out this guidance, because as you can imagine, the guidance that we may have received 2 days ago is not the same guidance that we need to be pushing out. And so it's really important that we use a platform that's efficient and can quickly get information out. A lot of individual consultation is also going on with some of these partners, with these agencies. So on a daily basis, between all of our staff, we're getting calls from a restaurant or from another local business, from a long-term care facility, from a school. So this is all information and that we're sharing as quickly as possible with our community partners as well. So also with community partners, a big piece of that is, as Lisa mentioned, the personal protective equipment, or PPE. So we've received, local health departments receive personal protective equipment through the Illinois Department of Public Health. We've received 3 shipments in total, and we've distributed close to over 16,000 products. With those products, that included long-term care facilities, police departments, social service agencies, and within the county departments. So there are guidelines and guidance that the state gives for putting out that PPE. Hospitals can request their own PPE, and so that's why they're not listed on what the local health departments have to deliver product to. And we tried to really assess, before the PPE went out, assess among the long-term care facilities what types of PPE they needed. And so there's a lot of room to improve. Obviously, you guys have heard on the news, I'm sure, that PPE is limited, and so we're trying to really conserve what we're doing with PPE. So community donations, we've received hand sanitizer from Whiskey Acres. They donated over 5,000 ounces of hand sanitizer that our environmental health team and our health promotion team have inventoried and have distributed to over 35 agencies. And so a huge piece of the community donations. Also, I know the county and the DeKalb County Farm Bureau are also seeking donations for PPE. So if you have access to PPE that you'd like to donate, you can call the health department, or what would be better is to email covid19@dekalbcounty.org. If your agency needs PPE, please also email that email address for requesting PPE as well.
So like many agencies in our community, we've had to make adjustments to the way we're providing services. Prior to the COVID-19 pandemic, we were working on most of our services were on a walk-in basis to best serve our clients. And so we've really had to do a 180 as it relates to how we're providing those. At this time, we're still providing services for our clients, and there is still need out there for those services to continue. We are making sure that we're taking precautions, however. A lot of our services are now being done over the phone and curbside. Early on, we started to do client screening, so anytime that there's an appointment scheduled, that client will be screened before the appointment is made. And when they present to their appointment, they're screened again for symptoms to make sure that we're not contributing to further spread. We also have began to do some immunization clinics in the front of our building. You can see the picture of the tent there. We're doing immunization clinics 1 time a week out front. And so we're still trying to continue services because we believe that the clients that we serve are still in need of those services. But we are also taking staff safety seriously and making sure that we're putting the right precautions in place.
I just do a shout out there. That tent was compliments of my friend Phil from the athletic department over at IU. So thank you for that.
So a lot of the community members and our partners have asked, what can we do, or what can I do? The most important thing that individuals can do right now is be sure that they are relying on credible information and sharing that credible information out to the people that they know. When we go for that credible information, it's looking at the World Health Organization website, the Centers for Disease Control, Illinois Department of Public Health, and our department website, which shares information from all of those sites. Making sure that you are following those mitigation efforts. They're put in place for a reason. We take them very seriously here. You can see that we're socially distancing here, trying to keep that 6 feet apart. And even though our employees are here working, we're encouraging them to do so as well, and we want you to as well. Making sure that you're washing your hands often with soap and water for at least 20 seconds and covering your mouth when you're sneezing. The more that we can do to adhere to the mitigation efforts, the faster we're going to come to a resolution for this. This is going to be around for some time, and we are all hoping that we can minimize the spread in our community so that our numbers do not get too high. But we do believe that we're in it for the long haul at this point. It's not something that's just going to be over quickly. And so the more that we can adhere to those mitigation, those recommendations, the quicker we'll get back to our normal state. And so that's really the most important things you can do at this time. Melissa mentioned the donating of PPE. You know, we're always willing to take PPE in its original packaging. Literally, we're getting that in and pushing that out as quickly as we get it. And so we are prioritizing based on the CDC recommendations and really trying to work with those partner agencies to get them protected as well. Okay, so that wraps up our presentation for this evening. We do have the email set up, covid19@DeKalbCounty.org. You can feel free to email questions to that email address. The newsletter that we send out, we're really pulling from those questions and trying to address any frequently asked questions. So please go ahead and use that email address if you have questions for the health department related to the response. I'd like to introduce our moderator here, Stacia Runge, who will be reading questions from you all who have entered it in the chat box, and we hope to get through them as many as we can.
Currently, we have no questions.
Okay.
You want to turn it back over to Judy?
Yeah. So Judy, if you're still on, do I need to
I'm still on, sorry. Were you going to read the question?
Judy, we don't see questions at this time.
Okay, well.
Aline here. The moderator would need to look at the QA pod and click on presenter view. Who's the moderator logged in as?
Is the moderator
logged in as DeKalb County Health, or is it under a different name?
The moderator logged in.
Okay, I will promote that person then so she can see it. Okay. Now the moderator should be able to see the questions. If you go to the QA pod, there's two little icons to the right, and click on the one that shows you all the different questions. Sorry, I thought we had that figured out beforehand, but we'll get it going here.
While you're working on that, I could say a couple of things. Should I? I want to apologize for those of you that are having trouble logging in. This is now becoming 7:30 is really a high peak internet time. So if you had some issues, we did record this, and you could go to NIU NIU's website and just type in STEMCafes, and it should bring you to the recording, and that should be up by tomorrow, I believe. So as we're waiting for any questions.
Okay, it looks like we're set with a few questions that we can see now. So are we ready to go?
Sure.
All right.
So some questions are asking about, can this virus be transmitted in the air, for example, on a windy day? Do the droplets travel?
I can take that one. Remember the 6-foot rule, and this particular virus tends to be heavier, if you will. So it does drop quickly, and there's no evidence that wind would help to perpetuate the spread of it. So again, though, it does that translates a little bit more into making sure that you're cleaning surfaces. And so if there has been an exposure just to a known case, you would want to try to leave, let's say for a room, for example, you would want to leave the room for a period of time, and there's controversy on how long that is. Again, remember, we're learning about this virus, it's new. And then use the EPA approved cleaners, and those are on the CDC website. You can look that up to see which ones are approved. There's not like a special formula really. Most of the cleaners we use every day are approved for that. But there's been no guidance or no information that the virus spreads more so like on a windy day.
Okay. Someone is wondering about whether DeKalb County healthcare professionals are wearing PPE when they're dealing with sensitive populations. And are healthcare workers being routinely tested?
Well, the routinely tested is, it depends on the organization. I know that especially those high-risk organizations such as the congregate settings or the long-term care facilities, they have been screening their employees for quite some time. They will screen them when they come in. They have them screen at home, and then they take their temperature and do a symptom check when they come in to make sure that they're not exhibiting any signs or symptoms. I know that some of the other congregate settings, such as Hope Haven, they are taking temperatures to make sure that, and doing screenings to make sure that they can try to identify something early and not introduce it into the organization.
Okay. How would people be alerted if there was a community exposure?
Communication, go ahead.
So if it was a community exposure as far as in a congregate setting, we would use the same information that we shared. So we would be sending out a news release for that. We would be sending it through the newsletter that we have people can sign up for, social media. And I didn't mention this before, but we also are part of a regional public information officer group. And so any new cases as far as when we all first had a case in the Northern Illinois region, or with any deaths that may occur within the region, we also share that information through the media outlets throughout the Northern Illinois region. So that's another avenue I forgot to mention earlier. So that's another way as well.
And in case the person asking the question is talking more on an individual level, if they were exposed in the community, that would be part of a case investigation and follow-up. So once again, that within 6 feet for more than 10 minutes, if you happen to be a contact of somebody who might have symptoms or have tested positive.
And remember when I went back to the grocery store situation too, finding out where people have been, that's part of the framing also. Is it a place, if it is somewhere in the community, is it a place where it would have been less than 6 feet for more than 10 minutes? Thus why, your restaurants, your bars, all of those kind of places, closed very early on because of the risk of transmission in that type of facility.
Okay, does the DeKalb County Health Department accept donations of homemade masks?
That's a very good question.
But I'll start, Cindy, and then I'll let you feed into that. So, at this time, the CDC does not recommend the homemade masks for healthcare providers unless it was a very last resort. And then I'll let Cindy take over as far as how those could be used.
And the thing to remember with the homemade masks are that there is no filtration capabilities in those masks. Even your surgical masks, your N95s provide the most protection, but the surgical masks also, there is some filtration available there. The most that the homemade masks would do is to, just like you're covering your cough or something like that, it provides a barrier there as far as transmission goes. Now, that being said, we have gotten some information that a lot of people are trying to contribute to the needs. And so an example of something that we do think is probably a good idea is that, like, for example, at some of your congregate settings, that while the idea is not to put a mask on, say, a resident, and I don't mean a nursing home, but I mean more of your homeless shelter, groups homes, those kind of things. What it would do is it would remind them to make sure that they are taking, if they're willing to wear one, remind them that we have to take these other precautions. And also, the whole thing about your hands touching your face, we don't realize how often we do that. And so it would be a reminder to them that, yes, you need to take that precaution also. So again, from a filtration standpoint, that is not a viable option for filtration. But we do kind of think that there could be some other uses for those masks.
There's a number of questions inquiring about whether there's antibody testing available because people would like to know if they've developed immunity.
That's a good question. No, there's not. Not at this point. As you know, they're working hard to develop the vaccine. So I know that along the way they are gathering the information so that eventually tighter testing could be done. But right now, the virus is so new or novel. I mean, basically novel. That's all it means. It's a new virus. It is so new that they have not been able to identify what those antibodies would look like from a testing standpoint. But eventually, yes, I'm sure there will be that capability.
Since there is a scarcity of a lot of our cleaning products, the wipes and so on, what are some of the best things people can use at home?
Right. So a great place to look for that information is the CDC website. They have a whole portion of their site that's designated to talk about disinfecting of households and businesses. Really, it's a pretty simple bleach solution that they recommend. So if you have bleach at home, a spray bottle, and water, you can make the solution that they recommend. And so I don't have the solution memorized, but you can go onto the CDC website and look for cleaning or disinfecting, and you'll be able to find that information.
And they give on that site, they give you the recipe or the ratios. Yeah. And we have pushed that out to a number of organizations because we do know that those cleaning supplies are not necessarily as readily available as they usually are. So we have shared that also. But yes, the CDC website has that information on it.
Okay, so we hear that the symptoms for this virus are changing frequently, and so people are wondering what they should be looking for.
That's a good question also. So as we have said multiple times, and I know you all know, but with this being a novel virus or a new virus, that's why the guidance keeps changing quickly, because we find out daily, we find out more. Same thing happened when, it happens with every new virus until you have cases that you can study and a number of cases rather than just, a few to get some reliable data on, then as they find out more, as they are researching along the way, the guidance changes. So the original signs and symptoms were fever, cough, usually dry cough, shortness of breath, and of course, as you know, the travel thing from the beginning, but that's kind of, it's still looked at, but it's not as much of an indicator as it used to be. So those are some of the things. What we are seeing some additional symptoms that they're still deciding if that is something, a symptom. So for example, abdominal pain and diarrhea, GI symptoms are coming up as a question. Is that going to be one of the signs and symptoms? So again, as these things come about and there's possibilities as the guidance changes and everything, we in communicable disease, we change our questioning when we're doing the case investigation. So now we are asking if they've had any GI symptoms, just for, if nothing else, for data collection.
Good. So you guys have stated that hospitals request their own PPE. Some people are wondering if you can expand on that a little bit about what protections are being made for the nursing staff and that. If you can maybe explain how they obtain that a little bit better.
Sure. As you know, hospitals all along, by virtue of what they do, they have their supply chain and they keep their supplies as best they can during just normal processes. Of course, they too are experiencing the same kind of shortages, and so what hospitals do, the health department and the hospitals are tied together in this, but they also kind of have their own reporting structures. And so the hospital reporting structure is that they request from a different entity, I guess. But if they see that they need, especially the resource hospitals from an EMS perspective, if they see that they have needs, then they are able to request through us. The process is, as it has always been, that the hospital requests is a form all ready to go, has been for years, and we've used it. The hospital requests through the local health department, and then the health department, it's not a gatekeeper thing, it's not a yes you get it, no you don't kind of thing. It's the path that happens, just so that so we maintain a particular path, and then we then request up through our local emergency management, who then requests from Illinois Emergency Management Association. So it's requested in that way. I do know that just yesterday the guidance has changed under some things, such as your congregate settings. The recommendation now is that everyone in a congregate setting, every employee in a congregate setting, wears a surgical mask or a procedure mask all the time while they are at work. And so there are guidance on things that we don't usually think of, such as extended use. How long can you wear that mask when it still be a viable filtration for you? So there's all of that guidance that is out there. I do know that the hospital here in town, Kishwaukee, as of 2:30 today, they went to the same guidance for their employees. Their employees have to wear a surgical mask for the entire time that they are there. Again, any kind of barrier, filtration, any of that kind of thing that we can do, that's what we need to be doing right now.
Okay. Several people are concerned, is there any risk of contracting the virus when they're getting food deliveries? And then on the other side of that, what if you know someone elderly in that who is having trouble getting food? What would be some resources?
Okay, I can do, you wanted the first part and I'll do the second.
Okay.
About
The risk delivering foods,
Mm-hmm.
yeah. The risk would be in the exposure, person-to-person exposure. That would be the risk that we would be talking about here. We're not worried about handing off bags or anything like that. The risk would be that. So again, I go back to the 6 feet for more than 10-minute rule, and so we have not seen any guidance that is a concern. And again, based on what we know about the virus and the guidance and guidelines that we function by right now, there's no concern about delivery food.
We would, however, always encourage hand washing. So one of the best ways to protect yourself if you're getting food delivered is to make sure that after you take that food and before you open it up, to wash your hands well. The other question was about elderly who may need food at this point. Our pantries are still providing food. We also have the food, the mobile food, the Mobile, and so there are resources out there. Elder Care Services is also still providing services, so reaching out to them about that person who may need food. If you don't have the ability to get a hold of Elder Care, send an email to us. We'll connect that person with the resources needed. Once again, we're having those community meetings with our partners. We're talking about what the needs are, and so we pretty easily be able to refer people for food needs.
Why don't you know your email address because it's different than the COVID?
Actually, they can use the COVID. That's fine. The COVID-19, we're monitoring that on a regular basis.
You know, another resource you can use too, speaking of social service agencies, Kishwaukee United 211. So that may be another resource. I know they were encouraging agencies to put information in the system, so that may also be another resource.
And VAC is still delivering also Meals on Wheels. So, and I know they're trying to broaden their scope there too during this time.
Okay. A lot of people are wearing masks, their own masks personally, out for protection. Do we recommend that? And if so, what kind?
I think that guidance is evolving sort of as we speak. Initially, the CDC was saying that unless you are ill, it would not be necessary for you to use a mask. We mentioned I think it's widely known that there's a PPE shortage, and so that's why that recommendation was what it was. We do see that sort of changing a little bit, and so as of today, I would say that unless you're sick, it's not necessary to wear a mask, but that guidance also could change as time moves forward. Cindy, anything more on that?
Well, I think just speaking of the types of masks in general, I think the understanding the difference between the masks, again, the N95 masks that we talk about, that you hear about, those are to protect the person who's wearing it. It is to protect them, especially the healthcare providers who do have close contact, and especially if they're doing anything that's going to aerosolize. So, for example, giving a nebulizer treatment would be one of those type of things. So the really close contact and really very much at risk. The surgical or procedure mask, if you've ever walked into a hospital during cold and flu season and with a sniffle, you know that they hand you a mask. So that mask, surgical or procedure mask, is meant more to protect the public from you. Now, that being said, with what we're doing now at the hospital and the congregate settings, we just delivered some of the procedure masks to the staff at the jail today. That being said, no, we're not trying to protect the worker from the public, the person. But again, we go back to that whole barrier thing. It is creating a barrier in the lack of N95 mask availability. It is creating that. It is creating that barrier.
Okay. Several nursing students are wondering if the DeKalb County Health Department is requesting any assistance.
Well, thank you. We love to work with our students, and the nursing students probably know that we do try to tap in. And when we do certain clinics, we pull them in, part of which is experience to give shots, give vaccines. But we also talk to them at the same time about this is a bigger picture. It is about the emergency preparedness model. Guess what? We're in the emergency preparedness model now. Yeah. And so when it comes to time for when a vaccine is available and we are doing clinics for vaccines, that would be a time especially that we will be tapping into our partners and nursing students to help us with that. So, but thank you for asking.
Kind of going with that, someone writes, you know, accurate numbers of those infected seem impossible to calculate without more testing. How far off are we estimating when the peak will hit?
So just this morning on a conference call with Illinois Department of Public Health, the date that I heard is April 16th as a peak based on their projections. You know, I think it's really, really hard to project, especially when we have a city as large as Chicago with as much activity happening there, and then all of these other communities, what they call downstate. But at this time, what I heard this morning was April 16th as a potential peak date.
Okay. Do any of you foresee there being more widespread available drive-through testing in our area?
We're hoping so. I think we're seeing a lot of companies who are developing rapid tests for COVID-19. We haven't seen those come to fruition quite yet. I think FDA approval still has to happen, but when those do come, I could see there being much more widespread testing done. Cindy, anything more on that?
I think just it's not a matter of anyone's in particular community not wanting to put our resources into doing the testing, but just getting the supplies is very difficult. Even the nasopharyngeal swabs that you need for the testing are very hard to get right now. The hospital has had to limit to only testing inpatients and staff. So they're even having to limit the amount of outpatient testing that they're doing. And again, that's just because of resources, not that people don't want to do it. But again, depending on what the guidance is, if the resources are available, we'll be out there doing testing.
Do we know if there is anything being done in our county, I'm assuming this is hospital related, for extra beds?
Well, first of all, let's talk about the beds that are there now, okay? The beds that are there now, all hospitals, and I know that our hospital has followed suit, is that they are at this point trying not to populate their beds in the first place. So, for example, very early on, all elective surgeries were canceled, and so that has freed up a lot of beds. I know when I was the director in the ER that we would always know that certain days of the week we were going to have trouble getting inpatient beds because of the surgeries that were going on. So by eliminating any of those elective surgeries, that is opening up those beds. The other thing is that making sure that they're not admitting unnecessary cases. So early on, the criteria for admitting someone, the bar was raised a bit, that this could really be taken care of at home. So they have been doing a great job to keep the beds open in the first place. As far as additional, I know that there is always a plan of alternative care sites that has to be part of a hospital plan, and I don't know and wouldn't be at liberty to say it either, but I know that is part of their plan. I just don't have any specifics on that to share.
Several people have questions regarding how long it can live on surfaces, such as the shopping cart handles and those types of things.
Well, do you want to take that? Because we just looked at that again today to make sure we had the right.
Yeah, so there's really, at this point, we just looked this morning, World Health Organization, CDC, they're sharing similar information. There's not specific amounts, there's not enough studies done at this point as to how long something may last. So that's something we don't have the answer for, unfortunately, at this time. So as soon as there are more studies done with that, that's something we would certainly, if they're reliable and credible, we would share through our media outlets and through our newsletter.
So far, the range is pretty nebulous. It's a couple of hours to a few days. So we wish we had a more solid answer, as does everyone. But at this point, that's what we know.
Okay. Are we keeping track of presumed positives?
Do you want to take that, or you want me to take that?
No, go ahead.
So we are tracking presumed positives as well. So for example, when we have a positive case who has a family member in the house who also has symptoms, they would be called a presumed positive. We'd be following up with that person and making sure that they were isolating as well. So the short answer is yes, we are following up on those folks as well. Yeah, it does not show up in that positive count, obviously. Those are only lab confirmed positives.
When the shelter-in-place order is lifted, will large group gatherings likely still be limited?
I think so. I do think so. I know in conversations with some of the groups, what I anticipate seeing is with my crystal ball that what I anticipate seeing is that those closures didn't happen right away, right? It was as things developed, then it became more and more. What I anticipate seeing is the reverse, that we'll start opening things back up slowly and watching to make sure that we're not seeing a spike again. And so I think it'll kind of maybe be like in a reverse order type thing and be done very slowly, very cautiously, very calculated.
I would agree.
Okay. Any ideas why this is so contagious compared to SARS or the flu?
Well, first of all, let's talk about the type of virus that it is. So the coronavirus is, the COVID-19 is a coronavirus. There are many other coronaviruses out there. So the coronavirus itself is not new. It's just the evolution of this one, the new type that this is.
Why is it white?
Oh, yeah. If you look at the video that we tried to show, he does a nice job of talking about that, why this is a little bit different. But the other piece is the contagious piece, but then also, the regular seasonal flu would feel a lot more deadly if we didn't have all the years of history to understand that virus and develop vaccines for that virus and develop personal immunities to that virus. So right now, yes, this feels very scary because of all those unknowns. We live in a much different time now than when the original flu virus was identified, and so information is being shared for better or worse. And because we are inundated all the time with all of that information, it becomes very overwhelming. Is this any more than what the flu would have been back in the day? I don't think so. I think that this will just become another one of those viruses. Once we have the vaccine, once we know more about it, I think it will just become one of those that evolve just like other viruses have.
Would it be helpful for the elderly to get the pneumonia vaccination for this?
Well, anytime that you can prevent other secondary infections from happening, that is definitely a plus, because you don't want those secondary infections to be the thing that makes this more than it needs to be. So even just flu shots, we were the guidance and a big push when this all started. If you haven't gotten your flu shot, get your flu shot, because then that way it's not going to help the coronavirus, but it's going to help other illnesses that might set in that would make you more susceptible, or maybe make you more sick because your system is already at risk because of another infection.
Any thoughts on people who are asymptomatic transmitters of the virus?
Yeah, the only thing I can say about that is that the most recent guidance is saying that it's likely that COVID-19, you can spread COVID-19 about 48 hours prior to your symptoms onset. And so we do think that is occurring, meaning the spread before the person is symptomatic. And so that's why this social distancing is so important, making sure that we're taking it seriously, making sure that we're doing all those preventative measures, because it's more frightening because it can be spread before you actually have symptoms. Anything more on that?
Okay. Is there currently enough PPE available for our local first responders?
Well, not knowing what their current quota or what their current supply is, I guess that's kind of hard to answer. I think this depends on the department and how the number of their calls that they get and all of that. But that being said, there is the mechanism in place that if they do need more, that they request it through the resource hospital. In this case, for most of our ambulance EMS people, that is Kishwaukee EMS system. So they would request it through that, and then the request would be made then through us, and then to our local emergency management person. So that we are told that that's the process. So we anticipate that the supply is there if it's requested, although that is not necessarily. I know people they're trying to meet the demands as fast as they can. Opening up different companies who normally don't make PPE, they're pitching in to make additional also, and so that's how they would request it though. So there's a mechanism in place for them to request.
And also, so I can't speak, as Cindy said, we can't speak on behalf of the healthcare system's supply, but what we can speak on is at least for those agencies that we are requesting for. And so I can say with the supply for long-term care facilities, gowns are needed, and the amount of gowns we've received is very limited and by no means meets what long-term care facilities have sent to us as requests.
And when we are able to request, the few times, as Melissa said, we've been able to get a couple of what we call drops. They let us know what's available, so it's not like we can dictate to them what we want. We were given the list, and we're given the amounts that we can order, and we get those. And the drops are not. I've been in emergency management for a long time, and I always envisioned the drop to be something like huge, like
Pallets or
something. Pallets, and I was around with H1N1, and it was a little bit more like that, where it was large drops and pallets. This is not what we're seeing right now. We're getting anything from half a dozen boxes to maybe a little bit larger. Melissa's been the one taking them in. So
on the slide, we have received over 16,000 PPE materials. So it is a lot that we've received, but as Cindy said, really when you break it down, a box of gloves or a container of gloves has, potentially 100 gloves in there. So when you break it down, as Cindy said, really we're getting a pallet at a time, essentially. So with the 3 drops that we've received, it's about a pallet that we're receiving.
So that's the reason why we look to both the guidance from IDPH and CDC as to who we should prioritize right now, but then we're also given local jurisdiction, knowing that each county is different, to take that guidance and decide what we know is going on in our community, who our priorities should be. So, for example, we knew, again, a congregate type setting, that long-term care facilities were a big priority to make sure that they got their stuff, because we certainly don't need an outbreak in a nursing home.
Do we have any information on the rate of false positives?
I have no information.
I'm not able to speak on that either.
And our attorney could answer there. Would there be any penalties to if someone was to, say EMS was called to a residence who they were falsely claiming that they were symptomatic and it was misuse of PPE?
Of course, we've had some cases that have come up in that same vein. The officers are trained, our first responders are working alongside our police to identify those situations, use their skill sets to identify real versus hoax situations, and there's always repercussions for lying or misrepresenting to law enforcement, and those cases will be charged and prosecuted.
And then past that, it's up to us to listen to what they are experiencing out there. So, for example, a traffic stop and someone starts coughing to try to get out of a ticket or something. One of the things we did very early on when we heard of that particular situation was we supplied the police officers with the procedure masks for each of their cars, so that if that happened, that they could take a procedure mask, hand it to the person, and say, "You need to put this on," because again, the procedure mask is to protect the person, the onlooker, I guess, from the person who's coughing. So trying to give them some tools to work with, also trying to listen to what they're telling us they're seeing out there.
Our community as a whole has been very cooperative and understanding, and nobody wants to get this, and nobody wants to be responsible for spreading it. So I think in general, our community has been very responsive to the requests that have been made to them, and I think that speaks a lot of our community.
There have been a lot of reports of people having no symptoms. Do you believe that to be accurate?
I do.
Yeah, I mean, they're saying right now it could be potentially 1 in 4, maybe asymptomatic or without symptoms. And so the more time goes by, the more we learn about this. And at this point, I heard that just this week that they're thinking 1 in 4.
So there's good and bad in that information.
Yeah.
The bad is that as far as containment of it and contacts and all of that, that's the bad news. If there's no symptoms, then and somebody doesn't even realize that they could be contagious, that's a problem. The good news to that is that it shows you that we and not to minimize by any means the severe cases, but it's such a broad gamut of what we're seeing symptoms-wise. So it goes from most people are mild symptoms that they can just take care of at home, or no symptoms at all the way up to having to be hospitalized in ICU. So
I'm trying to filter through our questions, but there's a lot of links to a lot of YouTube and different articles. Someone does want to know why none of us are wearing masks right now.
We are doing social distancing right now. As you see, we are 6 feet apart, and we're not in the category to have that as being the guideline right now.
Like 15 more minutes. I'm starting to run out of questions from our public.
Okay.
I'll check back in with Judy, see how she's doing.
I'm back.
How you doing there, Judy?
I want to thank you for your presentation and your service to the community, especially for your time and efforts to get the word out to the community. And I'm sure that you will continue to keep people updated and probably have a website that they can refer to. Can they go to the website at the DeKalb County Health Department if they have further questions? Can you?
Yes, a website, and then also on our website, the newsletter is also on there if you want to sign up.
Well, anyway, I want to thank you, and I apologize to our audience if they were not able to enjoy the entire experience because they might have been having some login or sound issues. This is our very first virtual STEM Cafe, and we'll certainly be working to work the bugs out, and we are planning some future virtual STEM Cafes, and we certainly would appreciate your feedback and any suggestions you might have for us, and you could give us some feedback at jdymond@niu.edu. We have recorded this meeting tonight, and as you can see on the slide here where you can go to get that recording. We also would like to thank our tech people here, the DeKalb County Health Department tech people that helped us this evening, and to Aline Click, who is our Director of E-Learning and Web Media at NIU, and her tech staff. So we appreciate all the help that you gave us to take the word out to the public here. And we will continue to improve our delivery and work on some future STEM cafes that you might be able to enjoy. And we certainly would like your feedback and suggestions for any cafes that you would like to see. And I thank our audience for joining us this evening.